Well, just 2 days after Governor Kevin Stitt announced new quarantine guidelines for the state schools, there are many questions about the data he cited. Now, the Oklahoma chapter of the American Academy of Pediatrics is giving a warning about the governor's policy. Tonight, 2 Works for You's Katie Kelleher investigates and shares why doctors say some of the data used as a guide for the policy doesn't quite fit with Oklahoma.
An effort to get students back in the classroom now raising questions among educators and doctors. The governor's new policy says Oklahoma schools following safety protocols and enforcing masks won't have to quarantine after potential exposure as long as the student or teacher isn't showing symptoms. Governor Stitt citing this study in the Journal of the American Academy of Pediatrics as part of his argument that all schools should be open to students. The study, done in 11 North Carolina school districts last fall, found extremely limited secondary transmission of COVID in schools in the first 9 weeks.
That means 99.96% of the students and staff they studied did not catch COVID at school.
However, Dr. Dwight Sublett, president of the Oklahoma chapter of the American Academy of Pediatrics, says while it's a well-done study, there are too many differences between the states for the study to be applied here. According to the Oklahoma AAP, at the time of the study, the North Carolina test positivity rate was 6%, and in Oklahoma, it's currently 23%.
We've had a massive increase in number of cases. So we know that when the number of cases in the community goes up, even if you've got good control in the classroom, it will still, the number of cases in the school, the classrooms, is going to rise along with that.
North Carolina also has a statewide mask mandate and other stricter distancing guidelines. Because of this, Dr. Sublett says if schools here want students in person, mitigation efforts must be done at a high level, and pediatricians recommend sticking with the CDC quarantine guidelines.
If we don't know who in the classroom is carriers of the condition should a case arise, then there could be further spread because, as we know, asymptomatic individuals can be carriers of this virus.
Bixby Public Schools is one of many in Green Country not planning to implement the new quarantine policy. All Bixby students are in person this week. Next week, high school students will be in distance learning and then back in the building the following week. Superintendent Rob Miller says it's inevitable that quarantine and isolation will happen over the next several months.
I mean, we applaud the intent. We all have the shared desire to have our kids in school and to stay in school. But at the same time, the rationale, the data to support that cannot be any stronger the other way because our case numbers are higher than ever, our hospitalization rates, fatality rates.
After most major districts decided to stay with CDC policy, Oklahoma Secretary of Education Ryan Walters issued this statement saying, in part, the recent changes to OSDH guidance for schools were driven by data from multiple sources developed by public health experts and similar to policies that are safely in place in multiple states. This shouldn't be political. We need to put our students first and allow them the choice to come back to their classrooms. Katie Kelleher, 2 Works for You.